You may have heard the healthcare system in America has issues. Issues of affordability, issues of access. But you may not have heard it also has issues of diversity. 1 out of every 4 Americans belongs to a minority group. Yet, out of every 100 healthcare workers, only 9 are minorities. Given the trend over the last 30 years, the numbers will only get worse, unless something is done. Here is what one group is doing.
Thank you for welcoming us to our last stop on the Tour for Diversity in Medicine.
So many years ago, Cameron and I were sitting on the telephone and we were talking about what we can do to reach out to students who weren't going to be able to attend another conference that we were planning, where we were bringing in hundreds of pre-medical students into a large conference. And we started debating, why can't these students come? And we came up with a number of reasons, be it financial barriers, time commitments, just not being in communication with the right people to even learn about the conference that we were putting on.
We realized that there was a need to reach out to students on their own home turf. So therefore, we created the Tour for Diversity in Medicine to use an old method of college tours on a bus and visit schools and bring our advice, our mentoring, our experiences to them.
We wanted to choose places that were on the cusp, places that had enough to make it worthwhile for us to come, but also they recognized that they still had a need and recognized that our contributions to them would be helpful.
We couldn't afford to pay for this. And I don't think that you understand that you're starting an earthquake. You're starting the kind of movement that we've needed for quite a while now.
We're very interested in expanding to other fields of the healthcare professions. We would like to continue to grow our mentor group so that we have new students coming on. And we want to just reach literally every state in the union at some point.
It's a Tour of Diversity, it really gets you a head start in the medical school. And being a freshman just coming in, I really wanted to get my head start now.
I've been thinking about obstetrics and gynecology, helping young women.
First and foremost, I'm here because I want to be a doctor, not just a black doctor.
What to do to strengthen my application, MCAT.
There's been a lot of hints given out. There's been a lot of insights that I wouldn't know beforehand prior to getting into this.
Getting in physician shadowing, because I haven't done that yet.
A lot of times you hear about medical school and the tax, it seems so daunting. But when you actually talk to people who've made it through who are in school, they're not too far from you.
Mentoring too, because there's not many professors here that are willing to do that role.
This is a once-in-a-lifetime experience.